And so for anyone who's for hearing your story for the first time and is maybe more on the left side and is wondering like, hey, is this guy a transphobe? That's the purpose of this question, is to get to the heart of it. So to set aside all the politics, to set aside the current, like the aspect of it sort of being promoted right now and perhaps pushing people into it that will regret it. And if we accepted that the majority of young people eventually become comfortable with their body, just to get to the heart of it, I'll say, for the small percentage that don't outgrow it, for if there was a transgender individual, that we're not talking about a child, they're an adult, they're one of the small percentage that never outgrew it. And if they were not involved in anything political, we're talking about just a person, how would you feel about that trans person?
Well, I mean, I would feel any trans person, okay, however they got to it, live and let live. I've got no problem with that. I've got no problem using any pronouns people want, as long as they're legitimate, like real pronouns. I'm not going to use made up terms because that just doesn't make sense. And I've just so your listeners know, I've treated a number of people who have trans issues, gender issues, sexual orientation, sexual identity. Like that's a big part of my practice, sexuality. I've had a number of trans students or non-gender, non-conforming, or atypical, non-stereotypical students and patients. My family, again, your listeners wouldn't know this, but I come from an extremely liberal family. My mother opened up Canada's first sex store. So being raised in that environment, in the early 1970s, having a gay brother and a gay sister, a number of gay family members. I don't think we have any trans family members, but my oldest daughter, a number of her friends are transgender or gender non-binary or non-binary gender. And they've come to our house all the time. They've slept over. They're welcome. Whatever pronouns they want us to use, we use. And so, anyone who tries to smear me as anything other than this, good luck in finding any evidence to this, to portray me that way. And I should stress that, like my other colleagues who have been tarnished as, hateful, transphobic people, I believe that for a tiny, tiny percentage of people, hormonal or surgical treatments is the only thing that's going to alleviate their dysphoria. And if we can provide it, I believe that they should do it, as long as they're older. They're old enough to make that decision. At what age is that? That's tricky. I think the early 20s is fine. Some people say 25. I would think 21 would be, I think, safe enough. And I understand that's a long ways to wait for people if they feel that they have to do this, but far better, to have enough time to make the right decision. And I'll tell you right now, there are laws in the states I know, or states that are trying to change laws so that any doctor who does do any of these types of treatments could be arrested. I wouldn't say that. I would say if they do it prematurely, yes, right, that you shouldn't suppress a child's hormones when they're 8 years old. But if they're a teenager and it's clear that since they were a young child, they were always dysphoric, or they always felt like they were that they wanted to be the other sex, and it persisted through puberty, and they've shown that they've got the mental capability, to know what they're doing, to make these decisions. In those rare cases as well, if they're a tiny, tiny proportion of the tiny, tiny people who would require it, I would say we shouldn't by law prevent doctors if they've done their due diligence, and that's the key. If they've truly gone through enough treatment and assessment, evaluation, and really discussed it properly, then I'd be okay with them, maybe doing early interventions. In the rarest of cases. In other cases, they should wait till they're adults. I just don't think that we should bar all treatments by law. So anyway, that's where I stand. And if someone can find something wrong with that, good luck to you.
Yeah, and I phrased it as a question because I didn't want to put words in your mouth, but my impression, it's been a while since I've watched your videos. I don't think your YouTube channel's been active lately.
No, not for quite some time, no.
But back when I did first go through your stuff, my impression of you was that you were the exact opposite of transphobic, that you were very supportive of trans people, that just like it's a very small minority of people who are trans, it's a small minority of people who have worked to support and help trans people. And it seems like there would be very few people in the world who have devoted more energy than you towards genuinely helping. And it seems even all the political stuff and bringing up facts that aren't popular, it seems to me is coming from a place of wanting to help trans people properly and not to be giving them bad advice, bad treatment, or to be confusing issues, or using them for political ends.
Well, exactly. And I'm glad that you did ask the question, because I've given these talks many times and I forget, if we don't give the proper setup, if people don't know all the context, it is very easy to make the wrong impression. So yeah, I do appreciate you asking that. And yes, I just want people, whether they're trans, not trans, gay, it doesn't matter what the issue is. I just want the proper help for people. And I want it to be done. I want it to be done properly. I want the best practices. And as I said, the top people in the world who are smeared as transphobic, Dr. Blanchard, Dr. Bailey, Dr. Zucker, Lisa Littman. Actually, I don't want to speak for Lisa Littman because I don't know where she stands, okay? But these other three names I just mentioned and a few others, they have clearly said that in cases where surgery or hormones is the only way to alleviate dysphoria and all the distress around being trans, they are all supporting it. And those three people, Bailey less so, but Blanchard and Zucker, they have written so many papers in support of trans people, yet they are considered the most transphobic on the planet by certain activists. And that word gets spread and people don't want to hear the truth. So, you know, anytime somebody comes out and speaks out against the trans orthodoxy or whatever the orthodoxy is, you risk your career, your reputation, your livelihood, your name. And, you know, I've had trans activists write to my college a number of times. They've reached out to my university. They've tried to get me, you know, they've reached out to radio and TV stations. They're trying to silence me. And, you know, and that's a problem. And if I was hateful and I was promoting lies, false information and stuff like that, fine, then I would deserve that. But that's not what happened. So there we are.